thank you so much. Welcome back to dvm360 Live. I'm Adam Chrisman, and guess what? She's here, everybody. She's here. So board-certified veterinary dermatologist from Cornell University School of Veterinary Medicine and her son, Gino, are going to talk all things dermatology related. Please give it up for the one and only Dr. Julia Miller. Hi.
Yeah.
So good to see you.
Oh my gosh, same here.
In person, we get to see you. And here's Gino, everybody.
He's very unfocused. Come on,
That's
Bob.
okay.
This
We
way.
got his lovely bed. Welcome to the set.
Gino, thank you so much. We're gonna get him right on bed.
Look
Good
at this
boy.
handsome boy.
Look at what he
Oh
knows.
my goodness.
Okay, sit. Okay, you can stay there. Good boy, Gino.
And we got Gino's pillow here for you too.
Oh my goodness, yes. This was given to me by a student.
Aw,
One of the best gifts
of course.
ever.
Well, you are. I'm so glad that you're here. So thank you for being here. And
Yes.
you are such a fan favorite by the students, by our colleagues in the profession. I got to ask you first, what does that feel like to you?
Well, you know, I love the limelight. No, it feels so good. And part of the reason I went on to be a specialist and to stay at Cornell is that I really wanted to make my impact in veterinary medicine a little bit bigger. I wanted it to be a little bit more than just case-by-case basis. So I'm thrilled when I hear people say that they learn from me, that they get excited about dermatology. That's my most favorite thing. When a student leaves my rotation and they're like, I think I want to be a dermatologist. Job done.
Yeah,
That feels so
definitely.
good.
Like hit that mark. Okay, so so you're, look at this, by the way.
Big Barker.
Someone just moved in.
Comfort. Comfort is king, right? He's maybe not using it exactly right, but we'll forgive him.
And we swear he's not on trazodone.
Not at all. This is what you see is what you get.
Right. Tell us a little bit about Gino, by the way, too, because he's stealing the limelight. I love it.
Gino is a wonderful dog. So I'm a huge bully fan. Obviously, as a dermatologist, I see them a lot as well. And he's actually a rescue that I got a few months ago. And he's just fit into the family super well. So, you know, love your adopted pets, rescue as much as you can. He's a real treat.
Yeah, he really is. I mean, just like getting ready for the show today and everything, he's just been so wonderful to everybody in the audience and too. So he's such a sweetheart there. We love you, Gino.
He's a lover, and he wanted to dress up for you today, Adam. So he wore his Sunday best for you.
You know, I can't even take it. You look so handsome.
Thank you. And he'll just fall asleep. So,
yeah, perfect. Look at him. He's like, I'm good. I'm chill. So, you know, dermatology.
Yeah.
What is it about it that brought you to that field?
So dermatology is quite literally in my DNA. My dad is a veterinary dermatologist, Bill Miller. And I actually tried to kind of fall far from the tree. I did large animal. I was a mixed animal vet for a while. But then as I did small animal practice and I saw all the dermatology cases, because I'm sure as you know, dermatology is sometimes 50% of what you see in a day, I found myself really gravitating towards it. And I actually fell in love with it despite the fact that I kind of tried not to. And that's what brought me back into dermatology. I'm really into the long-term case management, the client communication you get to build off of that. And I always tell everybody dermatologists are kind of like cooks and not bakers, in that I don't necessarily have a formula to follow every time. I do a dash of this, a dash of that, put it all together. It's different for every dog.
Yes.
And I really like that about it.
Yeah, I love that too. I've never heard that actually before too, so I'm going to steal that.
That's please do. It's yours. No, I mean TM, so you can't, but no.
Yeah, copyrighted it too. So there's so many wonderful things in dermatology. I think as a general practitioner, what I love about it is the fact that it's a very physical thing. Clients can see things right away, you know. What's one of the wonderful things that you love about being a dermatologist?
I think you bring up a good point. It's a contact sport. I like the fact that I have to use my eyes, my ears, my nose, believe it or not, right? I always say derm patients don't die, they just smell that way. So I really like that fact. I like that it's so multifactorial. And again, I like that I can really have a conversation and a relationship with the owner. Because in order for me, I mean, and Gino has allergies, as do all of my dogs, but in order for me to be successful treating him, I need you, right? I need the owner to be as invested in it as me. And when we see that pay off, when we see our treatment plan work, and then the dog is finally not itching himself, feeling really good, sleeping at night, that's what brings me joy every day.
So rewarding because teamwork makes the Yes, that's right. And I do say that to the clients, especially with veterinary dermatology. It's such a teamwork approach to medicine. So that's one of your favorite things. Now, what don't you like about some of the areas of veterinary dermatology?
That's a fair question. And it's kind of the same, to be honest with you. Like, I don't say cure very often, right? Like, I'm not the kind of person that gets to say, oh, your dog had a bad knee, I did surgery, your dog doesn't have a bad knee anymore. My patients tend to be chronic diseases, and every now and again you get one, especially in dermatology, that can just be really tricky.
Yeah,
And you can
yeah.
do the biopsies and you can do all of the diagnostics and still not exactly know what's going on. We have a patient right now we're dealing with, and that gets frustrating
Yeah.
sometimes because, of course, I want to fix everything as best I can. But we use all the tools we have and we try to do the best job we can.
You know, and you bring up a point that I think that a lot of our colleagues feel in veterinary dermatology sometimes is frustration.
Yeah.
So how do you work with the general practitioner when, say, I'm referring a case and you're like, Dr. Mill, I'm just so frustrated over this case. I've done everything. I've done the dermatologic database. I'm sending them your way. I'm throwing in the towel.
Fair.
Yeah. So how does that work?
Well, I think there's a few good things with that. One, remember that I exist. You should throw in the towel and send it to me because, you're busy. I was in general practice for like 3.5 years before I came back to do my residency. So I understand that you might have a C-section and a parvo puppy and 3 diabetic dachshunds, no offense, and all sorts of other things that are happening during your day. So the fact that you're not an expert on immunotherapy for an allergic dog, totally understandable. You have a lot on your plate. So I think one of the big things is use us dermatologists and use us early. Don't wait 5 years when the ship has already sailed. Then there's not much even I can do at that point.
Yeah.
So encourage your clients to understand the benefit of the dermatologist. That's a really big one. For example, remember that we do ear disease. Like in the human medicine, you don't go to your dermatologist if you have an ear infection because, vets are superior, but that's for a side note. So I think it's important that you communicate with your clients what my job is, that I will see the allergies, the ear infections, all the skin stuff. Do it early on if at all possible. And then also give yourself a break.
Right.
Derm disease is really hard. 15-minute appointments to talk about food allergies.
Yes.
Hard. Near impossible sometimes.
So tough. I had a client that said to me, she's like, Dr. Chrisman, I feel like you're breaking up with me. And I said, I am.
Yeah. For someone more attractive,
Right.
I mean, so it's okay.
Yeah, because it's true. Sometimes you just need another pair of eyes on a case to see what am I missing? What are some additional things? Maybe I'm saying things a little different, and you could do it a little bit better.
Yeah.
So that's the value and the beauty of having these specialty services in our profession, which is fantastic. I love it. Now, the other thing that I love about you, many things, those of you that know, Dr. Julia Miller is on social media. You've seen her in so many wonderful things in continuing education, from the webinars to in-person. How has that impacted the way in which you are a veterinary dermatologist?
Yeah, I really love teaching and communicating through continuing education. I'm a singer, right? Natural born sort of performer. So in a sense, that's the same thing.
You can't, I need a note. I need a note. You just can't.
I said it.
What? Holy smoke, you got me so excited. I dropped my cue cards.
It happens all the time. Don't worry, I'm used to it. It's fine. Autographs can be signed later. No, it's okay.
So good.
So for me, like, I bring that to when I do continuing ed because, man, have I sat in a boring lecture or 700 in my life. And so I try to make it exciting. I love dermatology. I live it. I breathe it. I think it's so fun. Recognizing it can be hard as heck.
Right.
But my goal whenever I do CE or whenever I'm teaching anybody is to make you as excited about it as me. Because when you like it, you're going to be better at it.
Yes.
When you fear it, you're going to hate it. It's a cycle. It keeps going. So I try to interject the joy. And also in all of my CEs, I remember what it's like to be a GP. So I'm not trying to say, you must, this is this, do it like a specialist. I try to make sure that I teach people in a way that is practically applicable to what they see and what they do every day.
And I think that's where, and a lot of your fellow American College veterinary dermatologists excel at, is the fact that they really make it practical, digestible sound bites. They show things on social media because sometimes it makes me feel like, oh, I'm not alone. Like, oh, like somebody found a Demodex and I was like, oh my gosh, Yeah. So I think that's wonderful. Before we wrap up this segment too, so give us a little sneak peek of like some of the exciting things that are out there in the world of veterinary dermatology.
Oh, sure. There's all sorts of cool stuff that's coming out, right? So I know this is more probably small animal geared, but like in the large animal world, insect bite hypersensitivity is really big deal with horses, and they're coming out with an anti-IL-5 vaccine. There's some really nice epidermal barrier work that's being done, so new topicals and sprays and pour-ons that work great. There's a product we're going to talk about in a bit, Fovea by Vetaquinol, and that uses light therapy. So there's always some really cool stuff on the verge in dermatology because, we're always trying to improve what we do. And I'm excited. Anything new that comes out, I'm ready. Let me try it.
I say this all the time. It's a great time to be a veterinarian. It really is, my friends, too. And it's so exciting that on the other side of this break, we're gonna look fancy and bougie,
Oh,
by
of
the way.
course. Thank you.
But we're gonna talk about Vetterkinol's phobia device too, and take a look at this commercial, and we'll meet you on the other side of the break here on dvm360 Live. Are you interested in adopting an adorable pit bull? Dr. Miller's going to explain some things that you should know about ahead of time. Take it away.
Absolutely. So I have a couple of rescue bullies. They are very near and dear to my heart. And I think the number one thing is these are good dogs. They get a bad rap. And I'm not saying that there aren't some that have some behavioral issues, true of any breed. But for the most part, bullies are loving. They are good family animals. The biggest thing is you just have to make sure that you're in the right place to adopt one. So a lot of them do need some structured training. Some of them actually have a ton of energy. Not so much this guy. He's more on the quiet side of things. But there are a lot of bullies that do have quite a lot of energy. So make sure that you're in a place where you can provide the exercise if you need it. They love chew toys. They will chew everything though, so you're not going to want to give them the gentle chewers. You want kind of the tougher things. And then I would say just make sure that before you get one, you try it out with any dogs you might already have, and also family members. Because sometimes, you know, they have particular personalities, so you just want to make sure that they fit into your life and your family.
Well, those are great tidbits too. And Gino thanks you all as well too. And
He's had a great time coming here.
Right.
I got him as a rescue, mostly to be a star, I think.
yeah,
actually.
oh yeah, look at him. He's already living it up. Well, thanks for being on, Gino. And thank you, Dr. Miller.
Yeah.